Endoscopic tissue sampling, Part 1. Upper gastrointestinal and hepatopancreatobiliary tracts. European Society of Gastrointestinal Endoscopy, ESGE Guideline. Introduction. Adequate collection and handling of tissue samples during endoscopy is fundamental in diagnosing pathology of the digestive system. The aim of this guideline was to make evidence-based recommendations on the indications and protocols for endoscopic tissue sampling for the most common conditions in the upper and lower gastrointestinal tracts and the hepatopancreatobiliary (HPB) tract. The lower gastrointestinal tract will be covered in Part 2 and published separately. Main recommendations. ESGE recommends that, where there is a suspicion of eosinophilic esophagitis, at least 6 biopsies should be taken, 2 to 4 biopsies from the distal esophagus and 2 to 4 biopsies from the proximal esophagus, targeting areas with endoscopic mucosal abnormalities. Distal and proximal biopsies should be placed in separate containers. Strong recommendation, low quality of evidence. ESGE recommends obtaining 6 biopsies, including from the base and edge of the esophageal ulcers, for histologic analysis in patients with suspected viral esophagitis. Strong recommendation, low quality of evidence. ESGE recommends at least 6 biopsies are taken in cases of suspected advanced esophageal cancer and suspected advanced gastric cancer. Strong recommendation, moderate quality of evidence. ESGE recommends taking only 1 to 2 targeted biopsies for lesions in the esophagus or stomach that are potentially amenable to endoscopic resection. Paris classification 0 to 1 and 0 to 2, in order to confirm the diagnosis and not compromise subsequent endoscopic resection. Strong recommendation, low quality of evidence. ESGE recommends obtaining 2 biopsies from the antrum and 2 from the corpus in patients with suspected Helicobacter pylori infection and for gastritis staging. Strong recommendation, low quality of evidence. ESGE recommends biopsies from, or if endoscopically resectable, resection of gastric adenomas. Strong recommendation, moderate quality of evidence. ESGE recommends fine needle aspiration, FNA, and fine needle biopsy, FNB, needles equally for sampling of solid pancreatic masses. Strong recommendation, high quality of evidence. ESGE suggests performing peroral cholangioscopy, POC, and or endoscopic ultrasound, EUS, guided tissue acquisition in indeterminate biliary strictures. For proximal and intrinsic strictures, POC is preferred. For distal and extrinsic strictures, EUS-guided sampling is preferred, with POC where this is not diagnostic. Weak recommendation, low quality of evidence. ESG suggests obtaining possible non-neoplastic biopsies before sampling suspected malignant lesions to prevent intraluminal spread of malignant disease. Weak recommendation, low quality of evidence. ESGE suggests dividing EUS FNA material into smears, 2 per pass, and liquid-based cytology, LBC, or the whole of the EUS FNA material can be processed as LBC, depending on local experience. Weak recommendation, low quality of evidence.